Hi, I'm Dr. Deeke, and today we're going to talk about how to give your pet insulin. So if your dog or cat has recently been diagnosed with diabetes and we need to start insulin on them, I'm going to give you a little refresher on how to administer it. Please remember that the insulin goes directly with certain syringes. So there are U40 and U100 syringes that come in different sizes. It is super important to match the insulin to the exact insulin syringe that you need to use, or else you may be giving them the wrong dose. So please double and triple check that you have the correct syringes that your veterinarian has prescribed and you continue to use only those. So Mamba is not diabetic. I'm not going to inject him today, but I will run you through the whole process. We usually like to give their insulin right after they've eaten, approximately every 12 hours, so as close to that as you possibly can get. And all insulin is stored in the fridge. So take this out of the refrigerator, and we don't ever want to mix it aggressively or shake. We just want to roll it gently between our hands so that the white mixture is easily dispersed into the clear mixture, and it's a cloudy white material, liquid that remains. So first off, I've already drawn up a little bit of sterile saline in these insulin syringes, which we will be giving him. The best parts of the dog or the cat that we kind of target for the insulin injections would be along their back and a little bit along their shoulders. We like to kind of rotate where we're giving them the insulin, so it's not the same exact spot twice a day, every day, forever. But roughly right along the front, kind of their shoulder area, and a little bit on their dorsal back is the best area, because you can pick up some extra skin here. You can create a little tent. They are easily going to put the insulin needle under and give the insulin underneath the skin that way. So I've already drawn up a little bit of liquid into this syringe. I'm not going to give it to him because he's not diabetic, but if he was, I would be taking the insulin top off the syringe and the needle directly in the skin. I will keep it capped for this because he does not need to be poked. So I'm going to lift up his skin here, and if this was the needle, I would be directly inserting it underneath the skin and injecting the liquid underneath his skin there. It's very quick. The needle and syringe are very, very small. The liquid is very small, so they hardly ever notice, and they do get really used to it. After that, make sure that you put your insulin directly back into the refrigerator and keep that stored there at all times. If you have any questions, or if they are not eating their full amount, please let us know, and we're happy to help you with dosing information. We do recommend after they start insulin therapy to recheck some type of blood work at least 2 weeks after we start any diabetic pet. So we could do a fructosamine, which is one blood draw, or a glucose curve, which is where they stay the day with us and we check glucose throughout the day. Please let us know if you have any questions, and if you need a refresher or anything at all, please feel free to call or text. Thank you.